Thank you again, everyone, for joining us. This is our first virtual sales summit, and our next presenter is Kyle. And Kyle, I don't want to mess up your last name too badly, so I'm going to let you give that to me. How do you pronounce your last name, Kyle?
It's Ingram.
Ingram, okay. So Kyle Ingram will be presenting Wellcare. We're really excited about it. And without further ado, Kyle, go ahead and just go ahead and get started.
Sounds great. Thank you very much. I appreciate everybody giving me your time today to go over our 2021 plans. We are extremely excited about some of the new features we have and a couple changes we made to a bunch of our plans that we think not only will be good for you, but amazing for the members that enroll in these plans with just some really beefed up supplemental benefits that will be helpful. So to get everything kind of rolling here today, what we're going to go through is our agent contracting and certification, our 2021 MAPD plans, our vendors for the year, a little bit on the Ascend enrollment platform. I'm sure you've been inundated with that stuff, so I don't want to bore you too much. Just want to hit the highlights. Ordering materials through Custom Point, our market contacts, and then, of course, a Q&A at the end with any questions you may have. So for 2021, we have a combined agent contracting process. Hopefully, most of you have gone through it by now and are all set. But those who aren't, we have until September 30th to get it done. But you can't order materials until everything is said and done. So please, please, please get in there and complete everything well before so that you can have all the materials you need before AEP kicks off. The combined contract includes all Centene affiliated health plans, including Allwell, Ascension Complete, Fidelis Care, HealthNet, and of course, Wellcare. That's going to be combined or accessed through the combined TPME contract in DocuSign. And like I said, that has to be done before September 30th of this year. We also have our annual certification through the Centene Learning Center, as well as you can sign up for AHIP if you haven't done that already. I'm sure most of you have, but if you haven't, you can do it for $125 through our discounted pricing on our site. And if you write at least 10 new MA or MAPD apps with a 1/1/21 effective date, you get reimbursed that $125. So that's a great incentive to get those apps in and get your money back. And just like the contracting, the ACT and AHIP must be completed before September 30th of this year. If you're not completed with all that by September 30th, it's not just 2021 plans that you can't write. You will no longer be able to write anything of a 10/1 effective date or later. So it's very important that we get those contracting and certifications done before the end of the month. Waiting for my system to move on to the next slide here. So those of you who have written Wellcare in the past know we traditionally have had 3 territories. We had a Greater Detroit, a South Michigan, and then a West Michigan. We actually combined the Greater Detroit and the South Territory this year. So that's going to make the Greater Detroit plans in Genesee, Livingston, Macomb, Monroe, Oakland, Washtenaw, and Wayne. And our West Michigan territory is going to be Barry, Branch, Calhoun, Kalamazoo, Kent, Ottawa, St. Joe's, and Van Buren. All right, and for the 2021 Greater Detroit service area, we are going to have these plans in all of those counties, which is the Essential, Explore, Elite, Elite Smile, and the Extra Plus D-SNP plan. And then in Genesee, Macomb, Oakland, and Wayne only, we're going to have the exclusive plan, which we will get to a little bit here. We're not going to go over all of them. The Essential and the Elite stayed fairly flat from last year in what's covered and everything else. So we're going to skip over those and focus on the Explorer, the Elite Smile, Extra Plus, and the exclusive plan for this year. So kicking it off, we have our Wellcare Explorer, which is an HMO POS. Those of you who may be new to these, the POS just means if they get a referral for an out-of-network provider specialist, will come to us for prior authorization. We'll then reach out to that provider to make sure they agree to the terms of our point of service contract and payment terms. And then that 25% coinsurance will be billed back to the client. It is a $0 premium, $3,450 max out of pocket, which is going to be on all of our plans. A bunch of these are going to be on all of them, so I may just fly through them on later so you don't listen to me drone on like a robot and we get you to lunch quicker. This has a $0 primary care copay, urgent care, labs, x-rays, and diabetic shoes and supplies. Has a $30 specialist copay, $250 hospital copay for days 1 through 7. And then the prescription tiers, 1 is $0, tier 2, $10, tier 3, $47, tier 4, $100, and tier 5, 33% on the prescriptions. If you do the 90-day mail-in through the CVS Caremark, tiers 1 and tier 2 are $0 copays. Tiers 3 and 4, you get 3 months for the cost of 2 months. On the supplemental side, this includes $2,500 in dental. Now, traditionally, you may remember we had that kind of broken up in the past. So we had $500 would go towards preventative and then $2,000 towards comprehensive. We did away with that this year. It's just $2,500 as the member needs it. We have $500 in vision, $4,000 in hearing. And then the new fun and exciting thing that we have this year is a $1,500 flex card. It's going to work very similar to like a prepaid Visa card. It can be used at any of the dental, vision, or hearing centers that accept Visa. And that can be used for additional cost share that goes towards covered dental, vision, or hearing services. So, for example, Bridges and Crowns always have a copay on there. You can use that $1,500 flex card to pay for the copay on Bridges and Crowns. On this, if you wanted the best of the best hearing aids, you could combine all that onto our $4,000 hearing, and you now have $5,500 towards hearing. So really, it's a fun, exciting new benefit that we think is going to be great for our members, and hopefully you do as well. This plan has $125 in quarterly over-the-counter. We did change our over-the-counter vendor this year. It's going to be with CVS. So that's going to be able to be online catalog. You can call in and order, or we're going to have a set amount of locations where they can actually go in store and use that over-the-counter benefit. That is use it or lose it. So it doesn't roll over. $125 per quarter. We want to make sure they are using it throughout the year. This also includes 24 one-way medical transportation trips. We're doing these one way because we found in the past that our members, they had a ride to the doctor or home from the doctor. They just needed help getting that other transport there. So we did 24 one-way trips. They can use it to and from. It would just be 2 one-ways. And then this also includes SSBCI unlimited non-medical transportation. So SSBCI is supplemental benefits for the chronically ill. This is going to go towards those members with diabetes, COPD, chronic lung disease, asthma, congestive heart failure, cancer, and or coronary artery disease, or CAD. This is going to be unlimited non-medical transportation trips. So they can use this to go to the store, to go grocery shopping. They can go to the mall. Really anything they need for non-medical transportation, they have unlimited trips. These include post-discharge and chronic meals if they get discharged from the hospital, or if they have a chronic condition that they can get the meals for, which is typically diabetes. And then 6 in-home support services. That's going to be with prior authorization, just services for chores around the house that may need to be done if they are medically unable to do so. And then all of our plans are also going to include a VRI, personal emergency response system, or the PEER system, that will be available to everybody without prior authorization. So that's our Wellcare Explorer HMO POS plan. Like I said, that flex card that you're going to be seeing throughout the presentation today, along with $0 urgent care and primary care copays, And then $30 specialist visits are really some key features on here that I think are going to help all of our members. Moving on to the next, if my computer will catch up with me here. There we go. We have the Wellcare Elite Smile, which is also an HMO POS. As you know, the Smile plans are always going to be dental heavy, so we'll get over there and talk on that in just a moment. But this does have a 40% POS option, does have a premium of $14.10 a month, and a $3,450 max out of pocket. $0 deductible for medical and prescription, $0 primary care, urgent care, labs, x-rays, diabetics, shoes and supplies. Has a $25 specialist copay, $200 inpatient hospital copay days 1 through 7, and then tiers 1 through 5 for the prescription drugs, $0, $10 tier 2, 45 tier 3, 100 tier 4, and 33% for tier 5. Again, with that mail-in, tiers 1 and 2 are going to be $0 copay for the 90-day through CVS Caremark. This has a $3,500 dental benefit, $200 in vision, and $1,000 hearing. It has $100 quarterly over the counter, 24 one-way medical transportation trips, includes that unlimited non-medical transportation for those with specified chronic conditions. Also includes the post-discharge and chronic meals, and that peers system through VRI. Again, the $3,500, there is no split between on the dental for preventative and comprehensive services that can be used towards one or the other. This one does not have the flex card though, so there is that little bit of way there. Honestly, if it's me, I think the Explore plan is going to be richer in the dental benefit and everything else with that flex card. Moving on over to our Wellcare Extra Plus D-SNP plan. This is also an HMO POS. We have the POS at 20%. That will, of course, in the D-SNP plan, we'll call and speak with the provider just to make sure they agree to our terms and that they're going to bill Medicaid for that 20% or go ahead and just write it off so it's not being charged back to the patient. $0 premium. We have a $3,450 max out of pocket. We have to put a max out of pocket on everything, even though it's a D-SNP plan. We have to assign a number. We have $0 deductible for medical and prescription. Again, that $0 copay for primary care, urgent care, labs, x-rays, diabetics, shoes, and supplies. $0 specialist, $0 hospital copay, $0 copay on the prescription drugs, and then LIS copay is going to apply on tiers 2 through 5. Here's where I think this is going to be an extremely rich plan for our D-SNP community this year. $4,000 in dental coverage, $300 in vision, $2,000 in hearing, and then this has that flex card, but at $2,500. So again, that is $2,500 extra dollars you can put on top of any of those limits spread across the 3 on that prepaid Visa card, essentially. So that could be up to $6,500 for dentures or $4,500 for hearing aids or a spread across the 2 if they need to. It's just a phenomenal benefit on that side. We have $350 in quarterly over-the-counter benefits. Again, that's through CVS. 24 one-way medical transportation trips. We have the unlimited non-medical transportation as well. Post-discharge and chronic condition meals, and this includes 12 in-home support services. I believe those are 2-hour visits each one. And again, that is for chores to be done around the house that needs to be done, but the member is medically unable to. And then the VRI peers system well is attached to this. So something we're really looking forward to this year. I think it's going to be huge benefits and something that can really get all of us excited to sign our members up that are in this community and be able to help them get some additional services that maybe they haven't been able to get under plans before. We're going to go on over to our Wellcare exclusive plan. So this is a plan that is only available in Genesee, Macomb, Oakland, and Wayne counties. This is designed for Oak Street Health members. It has a tiered system of in-network tier 1 or in-network tier 2. Really, all of the Oak Street is going to be in the in-network tier 1. There's a few that may not be Oak Street that are outside of it in that tier 2. We have a $0 premium, $3,450 max out of pocket, $0 deductible. And this is going for both tiers 1 and tier 2. The in-network tier 1 has $0 primary copay, urgent care, labs, x-rays, and the diabetic shoes and supplies. The in-network tier 2 is a $35 PCP visit. Again, if they're going to Oak Street facilities, the major chances that everybody's in tier 1. The tier 1 and tier 2, or excuse me, the tier 1 has just a $10 specialist copay, and then tier 2 has a 20% specialist out of network. But really, $10 specialist in network is phenomenal. And then they both have the $250 hospital copays day 1 through 7. And the prescription copays are both the same at $0 tier 1, 10 tier 2, 47 in tier 3, 100 tier 4, and then 33% on tier 5. Supplemental benefits on this, we have $3,000 in dental, $400 in vision, $2,000 in hearing, and there's that phenomenal flex card at $1,500 between the dental, vision, or hearing in additional funds they can use on that. $150 over the counter per quarter. There is 24 one-way medical transportation trips. We have the unlimited non-medical transportation, post-discharge and chronic condition meals, 6 in-home support services. Again, those are those 2-hour visits. And then the VRI peer system. So another plan, it's geared towards that Oak Street Health membership. It is going to be, at least from what I've seen, one of the richest plans that is a non-DSNP that we can find in the area for Oak Street Health members. So please keep this in mind when you're hearing who the primary care provider is, that this is out there for them. All right, we're going to move on over to the other side of the state now for our West Michigan service area. That is going to be all the West Michigan counties that we mentioned earlier, and I'll run through those again for you, which are Barry, Branch, Calhoun, Kalamazoo, Kent, Ottawa, St. Joe's, and Van Buren. Those are all going to have the essential HMO POS and the extra plus DSNP. And then we have our C-SNP plan, which is just in Barry, Branch, Calhoun, Kalamazoo, St. Joe's, and Van Buren. Again, that C-SNP is the diabetes chronic SNP. All right, so we'll go over to the essential HMO POS. That is 40% on the POS, $0 additional premium, $3,450 max out of pocket. We have the $0 deductible for medical and prescription, $0 PCP visits, urgent care, labs, x-rays, diabetic shoes and supplies, $40 specialist visit. The days 1 through 7 copay is $295. And then our tiered prescription copays are $0 tier 1, 18 tier 2, 47 tier 3, 100 tier 4, and 33% in tier 5. Again, tier 1 and tier 2 are going to have that $0 copay if they go through the CVS Caremark 90-day order. We have $500 in dental, $200 in vision, and $1,000 hearing, $90 quarterly over the counter, 24 one-way medical transportation trips. We have the post-discharge and chronic condition meals, and the VRI personal emergency response system, that peer system. So it's a good plan. It's the essential that we've had out there. I don't think there's been much changes from last year, but it's a great option over on the west side of the state there. Switching over to the DSNP plan, if my computer will catch up with me here. All right. So the Wellcare Extra DSNP, that is a 20% POS. Again, that is just, we're going to reach out when we get the prior authorization and make sure, whoops, I had one slide on me. There we go. Make sure that the provider agrees to bill that 20% to Medicaid or go ahead and write off that cost. $0 premium, $3,450 max out of pocket. $0 deductible, $0 PCP visits, urgent care, labs, x-rays, diabetic shoes and supplies, as you've heard me say 10 times now, I think. $0 specialist visit, $0 hospital copay, $0 tier 1 copay on the prescription drugs, and then LIS copays will apply tiers 2 through 5. We have $3,000 in dental, $300 in vision, $2,000 in hearing, and $2,000 on the flex card that sits over dental, vision, and hearing. They can use that on any of the additional cost share there. $280 quarterly over the counter through CVS. We have 24 one-way medical transportation trips. It also includes the SSBCI unlimited non-medical, post-discharge and chronic condition meals, 6 in-home support services, and that VRI Pierce system. And then going over to the Wellcare Guardian CSNP. Again, this is the CSNP that is just in select counties. Let me list those off for you again. And there's so many counties that I don't always remember them because I'm not on the west side often. It's in Berry, Branch, Calhoun, Kalamazoo, St. Joe's, and Van Buren. This is the CSNP towards diabetes. It is an HMO POS at 40% POS. $0 premium, $3,450 max out of pocket. 0 deductible for the medical and prescription. $0 primary care, urgent care, labs, x-rays, and that's shoes and supplies. We have, it's between $24 to $40 for specialist visits. The $25 ones are going to be those geared towards the needs of diabetes. And then the other specialists may be something non-diabetic related. $275 hospital copays days 1 through 7. We have $0 deductible, copay on tiers 1 and 2, $35 tier 3, $100 tier 4, 33% on tier 5. And then this includes at tier 6, the senior savers, $35 on the insulin. Switching over to the supplemental side, we have $2,000 in dental, $300 in vision, $1,000 in hearing, $60 over the counter through CVS quarterly, post-discharge and chronic condition meals. We have those 6 in-home support services, then the VRI personal emergency response system, and 12 routine podiatry visits as well. I wanted to go back quickly on the tier 6 $35 copay. We've had a lot of questions on this while doing our product launches. That only applies on our CSNP plan. We do not have that on any others. So just keep that in mind. The $35 tier 6 copay is just on our CSNP plan. All right. And then our last plan is going to be in all of our service areas, and that is the HMO dividend plan. So that again is in the West Territories and the Greater Detroit. This is a plan that gives a $100 Part B premium give back, $0 premium, $3,450 max out of pocket, $0 deductible. The primary care and specialist office copays are 20%. It has a per stay copay for the hospital of $1,500. We have a $0 deductible on tier 1. We do have a $445 deductible on tiers 2 through 5. We have, and then this just has our preventative plus dental, routine vision exam, routine hearing exam, and VRI personal emergency response system. So looking at it, not our most benefit rich plan, but where we see this having a nice fit for you is those healthier members that they just don't see the advantage of having all the additional services, but they really like the idea of the Part B being $100 less per month. This is going to be a great plan for them to get in, have a little bit of savings and extra money in their pocket each month. But that is the HMO dividend plan. So our 2021 vendors, there haven't been a ton of change in these this year. Our dental is going to be through DentaQuest, vision through Premier Vision, hearing with Hear USA. And as I've mentioned, the OTC benefits is now through CVS. Transportation is with Logisticare. Our chronic and post-hospital meals are through Mom's Meals. Fitness membership is Silver and Fit. Our in-home support services are handled through Maxim. The peer system is through VRI. And then our telehealth is with MD Live. Going into the Ascend platform, again, I'm not hitting this hard. I know everybody has seen a lot of Ascend lately, but what I wanted to hit is that it really is our preferred method of enrollment for 2021. As soon as you are contracted and certified for the year, this will be available to you in your Ascend portal if you already have one, as long as you are using the same email for us as you are the other carriers who have it. If you use a different email for us, you will have to have a separate login for that Ascend platform. This can be used for both MAPD and PDP plans. It is just not available for the CSNP. So you can use it for the MAPD and the DSNP and the PDP, just not our CSNP plan on the west side. When you're using the Ascend platform, it's not just the enrollments. It gives you some help with lead management, eligibility verifications, the rate system, offline enrollments. We have Blue Button integration, and then the value-based enrollments as well. We are doing the $50 for every VBE that is completed through there. So that is a way to earn yourself a little bit of extra money for not much extra work on your side. And along with that, it is going to give a much better start of care towards our members and making sure that they have everything they need. For 2021 agent materials, you can get those through Custom Point. I went in and did a mock order the other day. Whoops, my computer has a mind of its own, apparently. The one main thing you're going to want to take a look at is, I understand that when you're looking at the materials on Custom Point, the title of it may be a little confusing. Just look 2 rows over to the right and you'll see it say enrollment kit. That way you know you're ordering the enrollment kits. That will give a much better description. We're working on trying to get them to change that now, but for now, just make sure you're getting the enrollment kits by looking on the right-hand side. You'll see that listed right there. They are all now available as long as you are contracted and certified for 2021 through Custom Point. Those went up just later last week, so they are there and ready for you to order. Another reason to make sure that you are getting those certifications done. You want to make sure you order your materials and have everything on hand and ready to go for AEP to launch. So a few numbers for both you and your members. We have agent services that's open Monday through Friday, 8 a.m. to 9. That's going to help you out with certifications, commissions, anything on the agent side that you may have. Then we have our SPOP line, our special populations. That's Monday through Sunday, 8 a.m. to 2 a.m. Eastern time. That's going to help you out with the eligibility verifications and maybe pulling up some of the provider inquiries you may have. We have our AVL line for telephonic scope. That is open Monday through Sunday, 7 a.m. through midnight. Don't forget, you can also do the scope through Ascend. So you don't have to just use the AVL line. If you're doing Ascend, go ahead and just do the scope right through there. Just make sure the scope says accepted, not pending, before you move on with the enrollment. And then we have our member services line. So this is a good screen. If you have your phone out, go ahead, take a picture of it, screenshot it, just so you have it. IAD has these slides as well, so I'm sure they'll be happy to share them with you. But this is just some helpful information to have there for yourself while you're in the field. Then our Michigan market contacts. So there may be a name with a different title than you're used to. Emily Lalonde has moved into the account executive role along with myself. So we are doing most of what the traditional maybe district sales managers you were used to before with Wellcare handling. That falls on us now. And then we have Catherine Smith handling marketing outreach in Genesee, Oakland, and Saginaw counties, and Josh Wilkinson handling that in Livingston, Monroe, and Washtenaw. We are trying to find somebody to backfill in Macomb County, where Emily was handling her duties prior to coming over to the account executive team, and also the west side of the state. So we're actively looking for those, but for right now in any of those counties, feel free to reach out to any of us. We'll be happy to help out. That's really everything we have for today. I'm going to leave this screen up rather than go into that last Wellcare generic slide so that you have all of our information there. Does anybody have any questions that I can help out with? Anything you want me to go over again? What can I do for you?
If you could, hi Kyle, this is Yvonne over at IAV. If you could, I think it was a couple of slides back where it mentioned something about blue button. I think it was on slide.
The Ascend slide, yes. The blue button integration.
Yes, if you could go over that.
Yep. So blue button integration can only be used if you are sitting down with the beneficiary. And essentially what that will do, it will link their Medicare.com account over into Ascend, and it will automatically upload provider information, pharmacy information, and all of that to make it a more accurate and smooth enrollment process for them. So that can be integrated directly through Ascend. But again, it's something that you can only do if you were sitting down with them, because they will have to log into their Medicare.gov account, and you're not allowed to do that for them.
And that also records the prescriptions that might be looked up into that Medicare.gov account for them.
Exactly. Yep.
Wonderful.
Exactly.
Okay.
It flows everything over through that.
Is there a separate certification for the Wellcare or the Centene platform?
No. So there's not any separate certifications. Everything's done through the ACT for all the Allwell, Ascension Complete, HealthNet, and Wellcare. It's all one certification.
And it'll go over that, how to use the blue button. Okay,
yes.
Perfect.
Yep. It does go through that on the Ascend portion of it.
Right. That was something I just wanted to, highlight. I think that's a great tool, especially with the Medicare.gov having, everyone to create their accounts and then use a password. So this is a really great tool.
Yes. Yeah, it really does help with the transition and the enrollment as well when you use the blue button. The one thing I have to check, I'll hold off on it. There might be some additional news with that, but let me just verify it, and then I will shoot over a message to everybody to let you know if there's any additional information on the blue button. But that is a huge help in getting all the members' information into the enrollment platform and making a smooth transition.
Wonderful. Well, I just want to thank you, Kyle. I am just blown away at the new benefits, and especially that flex card that Wellcare is offering for 2021. I just really hope that the brokers take advantage of offering that to our public this coming season. So in closing, I'm Yvonne Blanco, the MAPD DSNP specialist at IAD. If you have any additional questions, need a contract, or would like to know how you can sell year-round with the DSNP products, please contact me or visit our website at www.iadbrokerage.com. Thank you all for taking the time to learn about Wellcare for 2021.
Thank you very much, everybody.